Welcome to Module 6. This module covers Chapter 6 and Chapter 7 from your textbook, Nutrition Counseling and Education Skill Development. Chapter 6 is about promoting change to facilitate self-management. First, we need to identify a behavior to change. As you know, as a nutrition counselor, we should be aware that some clients, they have a problem, but they need help identify what behaviors are linked to their problems or what behaviors are causing those problems. Some clients, they don't know that they have a problem. And that's very difficult scenario. But it is really good to have clients that they have already know that they have a problem, but we need to work with them as a nutrition counseling to kind of guiding them to identify that problem. So we can ask our clients to reflect on their behavior, on their lifestyle behavior, and can give clues as to what behaviors are in the greatest need of change. So one excellent method for evaluation is for the client to keep a diary of their food behavior. As a nutrition counselor, we have to become familiar with different strategies. There are different methods and strategies for promoting behavior change in order to meet our clients' needs. And since we have different strategies and different methods, for promoting behavior change, we don't have to stick to just one method. We can combine different method. We can apply different strategies for promoting behavior change for our clients. So, for example, at the beginning of a dietary behavior change, avoiding exposure to foods or setting where temptations exist may be emphasized. It depends on the time of the counseling. It depends where our client is right now. And here, this is a script, um, like how to kind of explain the need to learn new strategies to our clients. So, as a nutrition counselor, we can say having more than one or two strategies is very important for you. What we are trying to do is expand your toolbox so that if one tool does not work, you will have another. In many situations, you may require a combination of various tools. So, by stating this statement, we are trying to explain to our clients that they need some strategies in order to have a behavior change. There are different food management tools, and this table shows the advantages and disadvantages of each method. So we have meal replacements, detailed menus and meal plans, food lists, My Plate, Dash Diet and Mind Diet, goal setting, medications, and they have their own advantages and disadvantages. Meal replacements are useful for people who feel that other methods require an individual to spend too much time. So whenever our clients tries to save some time, they are tired of thinking a meal plan or whatever. Meal replacements are are useful for those individuals, for those clients, or clients who want to maintain a healthy body mass following an injury or surgery. Weight loss and reduction of cardiovascular risk factors. Meal replacements are really good. So, meal replacement can take different forms like shakes, soups, bars, and so on and so forth. And meal kit services are also an example for meal replacement. So meal kit services, there are some companies out there, they provide some prepared and like pre-measured ingredients and instructions for preparing high quality home cooked meals. So, and those are called meal kit services. Meal replacements were part of which clinical trial aimed at reducing weight in individuals with type 2 diabetes. Meal replacements were part of Look Ahead trial, which was this trial was conducted as a nutrition intervention for weight loss and reduction of cardiovascular risk factors. Detailed menus and meal plans, these are structured weight loss programs, including grocery lists, menus, and recipes in order to enhance dietary adherence. So it is similar to the meal replacements. Structure plans reduce the stress of making choices. So in detailed menus and meal plans, the clients and the individuals, they don't need to think much about how to develop a healthy meal for themselves. Because uh, we can provide a grocery list, we can provide different menus and recipes so they can just try different recipes. And these are very structured um, sort of food management tool. And there are some software programs, several websites, and smartphone apps that clients can use. Food lists, previously referred to as the exchange system. So, in the exchange system or food lists, there are different categories of foods, which is a little bit different than my plate and the dietary guidelines. So in this list, the food items are grouped by starches, protein, fat, fruit, milk, snacks, and desserts. My plate, Mind Diet, and Dash Diet. DASH stands for Dietary Approach to Stop Hypertension. So it is very useful for individuals who are trying to keep their sodium intake between 1500 and 2300 milligram per day. The Mind diet combines the Mediterranean diet and DASH diet. The Mind diet, it's the main focus of the Mind diet is brain health. That's why it's called Mind diet. And my plate, it is very useful uh, because it helps individuals kind of visualize their plate and understand the proportions of the major food groups to consume. You should be familiar with the food groups we have in my plate. And my plate is part of the dietary guidelines developed by the USDA, United States Department of Agriculture, USDA. In Dash diet encourages the intake of like legumes, seeds, and nuts. Um, the Mind diet encourages consumption of 10 specific foods like green leafy vegetables, berries, nuts, whole grains, fish, beans, wine, olive oil, and poultry. It also discourages the intake of 5 specific foods like fried foods, red meat, cheese, butter, um, sweets, candies, and so on and so forth. Goal setting is another um, type of food management tool. This is Goal setting is useful for clients who don't want any type of structured eating plan. They don't like my plate, they don't like Dash diet, Mind diet, Mediterranean diet. They don't like to have a recipe, a structured recipe or menus and etc. And this approach complements non-dieting programs for making lifestyle changes. Self-monitoring is very important. And again, just like food management tool, um, or like the different strategies for promoting a lifestyle change, we have different methods for self-monitoring. And these different methods has their own advantages and disadvantages. So tracking method is a self monitoring method, and it depends on client's ability to work with structure and details. In counseling sessions, we as a nutrition counselors, we can review our clients' record with our client's record with our client and search for triggers and patterns that help or hinder food behavior goals. So if we ask our clients to track their dietary intake, for example, or track their sleeping pattern, track their physical activity, and other their like lifestyle, other aspects of their lifestyle, it's better to review those like you know uh record with the client. So journaling is one way. It's one method um which is used to analyze and modify behavior. So this is part of a tracking method. It's very effective in changing behavior in general and food habits in particular. In this method, in journaling, food intake should be recorded immediately before or after eating. This is a very important point. Immediately before or after eating, food intake should be recorded in journaling method. A food diary would include a list of foods consumed, and a journal may also contain portion sizes, calories, fat grams, fiber, and physical activity. So journaling, um, you know, it takes time. It's time consuming, but it's very useful because it is more detailed and it can help us, both nutrition counselors and clients. Before asking the clients uh, kind of use journaling method. First of all, it's up to our clients to choose what method they want to go with. So we can just provide some some guidance and some instructions for different methods of tracking, but we cannot impose um, this method on the clients. So if the client chooses journaling, we need to provide some guidance here as nutrition counselor. We need to provide some training. What do we want from our clients to track in their journal, to write down in their journal? So we have to provide training. We need to also remind them that they don't have to write down exact amounts of food consumed because sometimes it can get tricky. And in order to reduce anxiety, uh, our clients should understand that approximations are acceptable. We need to set meaningful and achievable goals. We need to provide a variety of record keeping options. We have to provide non-judgmental feedback. This is also very important. So whenever we review the journal with the clients, we have to return them with brief comments, but not judgmental comments. And clients should be also encouraged to write questions in their diaries. And electronic monitoring, which is like digital photography monitoring, audio, video, food journaling, and a variety of smartphone apps. So we can also kind of let them know that there are other options for journaling. So as I said, there are different methods for tracking, and also there are different approaches to journaling. So there are some ideas on how to have a creative journaling. We have checking off, using art, and empty bowl. But again, there are more than these, but these are some useful approaches. Behavior change strategies. We need to incorporate some behavior change strategies into our counseling sessions, into our counseling program. And there are different types of strategies for behavior change. But before choosing a specific strategy or a number of strategies, a number of behavior change strategies, we need to we need to be aware of our clients' motivational stage, resources, lifestyle, educational, and emotional needs, and the expertise of ourselves, like the skills of the counselor or ourselves. And we need to tailor the counseling approaches or behavior change strategies to client needs, which ultimately improve the outcomes. One of the behavior change strategies is it's called 5A model. 5A model includes assess, advise, agree, assist, and arrange. This model was designed for implementation in busy clinical practice settings. It is action and solution oriented. Please refer to table 6.2 in your textbook for this method. Another behavior change strategy is called ABC model. A stands for antecedent, which means any kind of cues or triggers. B stands for behavior, which is the response or eating. And C stands for consequences. And there are two types of consequences, punishment or reward. So antecedent or stimulus cue trigger. there are there are some factors that can cause behavior. Behavior is the actual act of eating or physical and emotional factors. And the consequences can be punishment or reward. So we have positive reinforcers, such as a reward, punishments, such as losing a privilege. There is another term, it's called behavior change. And the definition is the sequence of events from antecedent to consequences. We have to have a cue management, or we have to, in other terms, we need to manage the triggers, we need to manage the stimulus or stimulus control. Cue management deals with the antecedent component of a behavior change by prearranging cues to increase a desired response or suppress a detrimental one. And in order to do that, in order to have a queue management, we need to work with clients. So this is an example of using using a method to introduce queue management, and here is a script to that. So for queue management, there are some other components in order to have a beneficial queue management, like sticky notes left in strategic places, such as on the refrigerator or dashboard. Notes are on a calendar reminder. Um, Cartoons or jingles posted in a book or briefcase used every day. Entries on a daily to-do list, electronic messages on a smartphone. So these uh, kind of scheme should include reminders to perform the new activity. Countering is a technique of exchanging healthy responses for problem behaviors and addresses the B portion of the behavior change. B stands for behavior, which is the response or eating. Countering is a usable behavior intervention strategy when the objective is to find an activity to substitute for eating. So, here's an example: foods that are acceptable or are a healthier alternative. Active diversions such as knitting, writing, or playing an instrument. Physical activities such as walking, stretching, or weightlifting. Relaxation activities such as deep breathing, yoga, and prayer. So these are some examples, and we are trying to substitute these activities for eating, or when an acceptable food alternative is available. This is called countering. And this countering addresses the behavior portion of the ABC model. Reinforcement or rewards. Reinforcement behavior change strategies, they provide incentives by addressing the end of the behavior change or consequences. So rewards can be tangible or intangible incentives. They provide positive consequences. The reward should be individualized, well defined, time to come after the behavior, not before, and given as soon as possible after the behavior is accomplished. So, as a nutrition counselor, we need to work with our client and we need to help them come up with some rewards for themselves if needed. They don't have to, but if they want some rewards, we can help them. We can guide them to come up with some individualized reward. We need to kind of teach them about the timing, about the what and how much, um, and on other factors. So they have to take different factors into account if they want some reinforcement for their behavior change. Contracts are some, these can be some, these can be part of the counseling session. And a contract is a document or an agreement between a counselor and a client to implement a particular goal. The contract can cover short or long term goals. Contracts should be used when clients want structure and accountability. They should be recorded. Signing and dating the contract can reinforce a client's commitment. But there are different factors we have to consider when using a contract, and we need to kind of remind the clients of these factors. We need to define the behavioral goals. We need to also state the reinforcers, both rewards or punishments. And clients should define their intended behavior change for the contract. And we need to sign and date this contract by ourselves and by the client. This is an example of a counseling agreement. So we have name at the top, and we have date, and then we have my plan is to do the following. This activity will be accomplished on, and then my reward will be, and also we can add punishment to the contract if the client needs some, other types of reinforcers. Encouragement is also very important during counseling sessions. We need to be aware of this. So, encouragement is generally well received. So, a client's past experience when they were trying to accomplish a desired behavior change can influence the impact of encouraging remarks. For encouraging, nutrition counselors can use different methods by using emails, cards, notes, voicemail, text messages, or electronic recordings. There are different approaches to encouragement. Goal setting, as I mentioned, goal setting is one type of food management tools, and goal setting is very important um, because achievement of goals provides a pathway to actually performing the new behavior. Breaking down desirable behavior patterns into small achievable steps provide a series of successes and an improvement in self-efficacy. Modeling, this is also very interesting. As human beings, we all learn many of our behaviors by observing and imitating others. This is very important when we try to adopt a new behavior or whenever we try to change our lifestyle behavior. We can also use modeling. So modeling can be achieved by watching videos, written testimonials, success stories, counseling bodies, and role playing. Problem solving is a process that involves a counselor and client working together to identify a behavior change, detecting barriers to change, brainstorming possible options, and weighing the pros and cons of the alternatives. So, the objective of problem solving is to design an action plan focusing on the antecedents of the chain, behavior chain. And the action plan should include a reward. There is a technique for problem solving. It's called STOP, which stands for S stands for specify the problem, T stands for think of options, O stands for opt for the best solution, and P stands for put the solution into action. And the barriers are obstacles or roadblocks to achieving a desired lifestyle change. There are different types of barriers, and we have different strategy to address those specific classes of barriers. So for example, lack of knowledge is a barrier. Lack of skill is another barrier. Lack of risk taking, lack of time, lack of access to transportation and facilities, inadequate finances, restrictions in the physical environment. These are some barriers, but we have to have some strategies to address these barriers and obstacles during the counseling session. So, this is an example. A person wants to reduce their blood pressure through diet, but feels overwhelmed at the grocery store and doesn't know which foods are healthy choices. They rely on prepackaged meals because they are unsure what to buy. So, this is an example of lack of knowledge because the client doesn't know what foods can lower blood pressure. The strategy here, as a nutrition counselor, is to provide pamphlets, videos, internet sites, and grocery store tour to kind of help them gain the sufficient knowledge when they want to purchase um, food from grocery stores. Cognitive restructuring. This is a very important concept in nutrition counseling. This means that challenging destructive thoughts, beliefs, and internal self talk and substituting self enhancing cognitions. So, here in cognitive restructuring, the focus is on identifying irrational thoughts and modifying them. Cognitions is what and how a person thinks and perceives based on life experiences. That's the very definition of cognitions. And these cognitions are learned thinking behaviors can be relearned. That's why it's called restructuring. There are two types of thinking patterns. We have opportunity thinking and obstacle thinking. Opportunity thinking is finding constructive ways to deal with difficult situations. Obstacle thinking is self-destructive behavior, like giving up, retreating from problems. So we have two types of thinking patterns. As a nutrition counselor, we have to be aware of these concepts. We need to know that there are two types of thinking patterns. Some clients, they they have opportunity thinking pattern, but other clients, they have obstacle thinking pattern. But we have to be aware of these two different patterns. So here are some negative thinking, like give up, excuses, should, must, have to. These are like common negative thoughts. And these are some examples. I had potato chips. This is not working. I give up. I'm a jerk for eating that candy. I'm worthless. These are all negative thoughts. These are all obstacle thinking pattern. So the cognitive restructuring is the process of changing dysfunctional thinking pattern by addressing three factors: internal dialogue, mental images, and beliefs and assumptions. In order to change obstacle thinking, we have 5 steps. First, education. Then, identify dysfunctional thinking. Explore validity of self-destructive statement. Stop destructive thoughts. Prepare constructive responses. Substitute automatic dysfunctional cognitions. Education during counseling, it's very important. Education is the primary step to changing dietary behavior and maintaining dietary objectives. That's education. Our clients must understand why dietary change is important. So we need to educate them. We need to provide the advantages and the pros of changing dietary behavior. We have to educate them because education is the first step to changing dietary behavior and maintaining that behavior. So education is very important. Poor health literacy and beliefs were associated with poor long-term treatment adherence. In a trial, clinical trial called Diabetes Control and Complication Trial, patient education was an integral part of the successful trial. So these are some effective education strategies. So if our target is knowledge or beliefs, the intervention should be like didactic education. Or the target is skill, the demonstration and feedback are very useful interventions, and so on and so forth. So we need to have some approaches to education during counseling sessions. So we need to review role of client as self-manager and role of counselor as a source of expertise, support, and inspiration. We need to elicit client concerns and questions, discuss clients' experiences and understanding of their condition. Identify what the client wants from the counselor. We need to explore behaviors the client wishes to alter, and we need to present information to address concerns and questions. We need to discuss strategies to address the behavioral aspects of concerns. And these are some effective education language. Instead of saying, you should eat less saturated fat, we need to say, those who decrease their saturated fat intake reduce their risk of heart disease. So it's better to kind of, prevent using the word you in the counseling sessions. You have to start exercising more often. Instead of saying that, it is better to use some statements like exercising at least 5 days a week helps keep blood pressure normal. So consumers have indicated that positive messages focusing on healthy food choices were more motivating than avoidance messages. But we can use a moderate amount of fear, which can be useful for motivating a client to make a change, but we should not scare them. We should not scare the client. But it is better to use a moderate amount of fear. So the next part is about supporting self-management. We have two terminologies here: adherence or compliance and dietary adherence. So adherence or compliance is following advice, recommendations, diet orders, or a prescribed regimen. That's called adherence or compliance. Compliance is a little bit old word, so these days we use adherence. And the dietary adherence is the degree to which an individual's health behaviors coincide with the health objectives as set by clients in collaboration with their health practitioners. That's the very definition of dietary adherence. As we discussed this in previous modules as well, the nutrition counseling should be tailored to meet client needs, their goals, and their living arrangements in order to enhance adherence. And gradual stepwise modifications are recommended for changing dietary patterns that will endure. So if we just jump straight to a big change in dietary behavior, probably we will fail. So gradual stepwise modifications are recommended. Perception of quality of care is related to adherence. So a warm, caring environment, it's, you know, it can create an environment conducive to counseling. Um, this will increase the client's adherence and compliance. If we attempt to arrange a meeting place that is attractive, comfortable, cozy, quiet, adequately lit and private, these can also kind of help with the perception of quality of care. The arrangements should be made so that phone calls and staff members do not disturb sessions. Sometimes clients will not change. They will not adhere to their dietary behavior, changes. And by doing that, they leave the counselor, the nutrition counselor, feeling frustrated or even angry. But remember, we are there to assist our clients. That's our clients who have the responsibility to make changes. So that's not on us. That's on them to make those changes. So we shouldn't feel frustrated. We shouldn't feel overwhelmed if clients do not change. That was all about chapter 6. The next one is about chapter 7. And in this chapter, we will cover some other aspects of counseling sessions. Social network is very important. The act of eating itself is often a social activity. And based on psychology related articles and literature, a client's or a person's an individual's social environment have a significant impact can have a significant impact on attempts to change eating behavior. Or in general, we can say a person's social environment affect our behavior or affect our motivation level to change our behavior. So that's why social context is a component of several behavior change theories. And that is why we have social network in the component of the nutrition care process. So, ability to build and utilize a network of family, friends, colleagues, health professionals, and community resources for encouragement, emotional support, and enhance one's environment to support behavior change. These are very important. The people closest to a person making dietary lifestyle changes will be affected by new behavior patterns and in return can exert a powerful influence on our client. The changes, sometimes dietary or lifestyle changes, or in general behavior changes, can put a stress on the dynamics of a household. So, one way of helping dispel negative feelings is to involve people closest to our client in our counseling sessions. So, this is a very good example. Here says, one of my clients was an older female who had kidney disease and had a number of factors in her diet that had to be monitored. It was my responsibility to design a discharge diet plan for her. She was a very, very nice person, but she told me she would never be able to understand the diet because she had never been good with numbers. We scheduled to have her son meet with us for another time, and all together we designed a detailed food plan. So this is a way of using social network aspect of nutrition care process. We have to kind of encourage our clients to have a social support, family support, or any support from the society, from the community, from friends. Those are very important because they have the social support has a beneficial effect on uh, uh, dietary change objectives. So, for example, there was a study, and the investigators found that family support for adolescents' diabetes care was shown to increase adherence to healthcare protocols. So, social support is very important. The positive effects of social support on health is that clients perceive a sense of support from others, leading to a feeling of a more generalized sense of control. And a greater sense of control often results in an increase in self efficacy. So that's why we need to encourage our clients to be vocal and request support for cooperation and assistance from their family and friends. To keep the social environment conducive to change, counselors should remind clients to thank others for their involvement. We have to have some suggestions if the clients don't have readily available support from family, from friends, from community, from society. So here, these are the suggestions. As a counselor, we can provide these suggestions. We can ask client, we can ask our client to locate a distant support body, to join clubs or organizations, to locate a social support group, to take classes in order to find some friends, to find some social support. Social disclosure. The definition of social disclosure is sharing information about oneself in order to enhance lifestyle change objectives. So, disclosure of behavior records and progress in meeting goals to peers or professionals has been shown to exert a powerful influence in changing behavior. Even announcing the intent to engage in a new behavior can have a significant influence. So, for example, if I say to my friends, to my family members, to my neighbors or whoever, I intend to, let's say, quit drinking alcohol, for example. By announcing that, that announcement can have a significant influence on my new behavior. So, regular disclosure can be done formally in a weekly meeting with support bodies or informally while walking or eating lunch with friends. So, social disclosure can also be useful. Social pressures. A client's immediate social environment can sometimes exert a negative influence on eating behavior. So we need to ask our client to seek ways to reduce the impact without causing undue social stress. Role playing, microanalysis of the scenario, or mental imagery. These are some, strategies uh, can be used to address social pressures. So here is this role-playing guidelines. The microanalysis of the scenario and mental imagery. So microanalysis of the scenario is used to talk through an anticipated experience, identifying as many contingencies as possible and deciding on the best response. The mental imagery is a mental rehearsal of an anticipated experience. Mental imagery is a common technique for developing new behavior patterns. In mental imagery, clients imagine themselves thinking, feeling, and behaving in precisely the way they would like in the actual situations. So here is an example. Client, I don't know how to bring up my cholesterol issue with my family. They might think I'm overacting. Counselor, let's walk through it. Where will you be when you make the phone call? What do the surroundings look like? What will be going through your head? So, which technique is the counselor using to help the client is the microanalysis of the scenario because it is used to talk through an anticipated experience, and we are asking different questions in order to identify as many contingencies as possible and deciding on the best response. So this is an example, or this is a technique of microanalysis of this scenario. Stress management is very important. Stress is a condition or feeling experienced when a person perceives that demands exceed the personal and social resources the individual is able to mobilize. And there are three phases of a negative response to distress: alarm, reaction, resistance, and exhaustion. We need to be aware of the fact that major life changes are stressful events because they often require a series of new adjustments. We have seven indicators of stress: increases in blood pressure, suppressed immunity, increased fat around the abdomen, bone loss, increases in blood sugar and levels of cortisol, weaker muscles in the abdomen, increases in blood cholesterol levels. So, in the stress management counseling focus areas, we have different categories. We have environmental focus, physiological focus, cognitive focus. So, we need to kind of address stress management during counseling sessions if our client um, kind of, inform us that they have some issues with stress and anxiety. Sleep counseling is also very important. As a nutrition counselor, we need to be aware of our clients' sleeping pattern and sleep quality because sleep quality and duration affect weight and health. The recommended sleep duration is 7 to 10 hours. And there are different factors affecting the quality of sleep, like electronic media exposure, caffeine and alcohol consumption, and so on and so forth. We can use different, kind of scale or questionnaire to determine the sleep quality of clients. One of which is um, Pittsburgh Sleep Quality Index, Epworth Sleepiness Scale, and the Berlin Questionnaire. So there are different options we can use to determine the quality of sleep of our client. There are different programs we can encourage our clients to kind of utilize those programs. There are some websites, for example, the American Academy of Sleep Medicine is a credible resource our clients can use. There are some food items which can help with sleeping. And these are sleep inducement, like tart cherry juice, almond butter, um, kiwi, and there are other food items. So, as a counselor, we can say, um, from what you say, I understand that you have a problem falling asleep at night. I have some ideas. Would you like to hear them? And then if the client says, yeah, of course, so we can say, here's a list of sleeping tips that has worked for some people, and here's an example of a bedtime routine that has worked for an individual. So we can provide different options and different strategies, and then say, how do you feel about developing a routine that you could experiment with? So these are some questions like, what time do you go to bed every night and wake up every morning? We have also desired answers here. So we need to be aware of like the normal or recommended sleep duration, which is 7 to 10 hours. So like whatever it's above or it's below the 7 hours, it can kind of indicate a problem. Mindful eating or intuitive eating is a very important concept, which means a slower, more thoughtful way of eating. This is a method encouraging individuals to use their inner wisdom to find joyfulness in the preparation and consumption of food. So mindful eating has a root in Buddhism, which encourages um, kind of like thoughtful way of acting or thoughtful way of behavioring. And there are different components for mindful eating, like enjoyable eating, eat slowly, focus on eating. So that's why they say do not like watch TV or do not work with your computer or don't do anything while you are eating. Just focus on eating. This is part of mindful eating. Relapse prevention is very important. Relapse prevention is a systematic approach to maintain a behavior change, involving the identification of and preparation for high risk situations. There are two major categories for uh, there are two major categories of relapse factors. We have immediate determinants and we have covered antecedents. And this is the cognitive behavioral model of the relapse process. Why is it important to help clients view a lapse as a normal part of the change process rather than a failure? Because viewing a lapse as a normal part of change helps reduce guilt and prevents it from escalating into a relapse. So, as I said, there are two major categories of relapse factors, one of which is immediate determinants. Immediate determinants can be high risk situations, a person's lack of coping skills, positive outcome expectancies, and reaction to a lapse. So here, let me define these two terms, lapse and relapse. Lapse is a single act, a slip, and a momentary return to previous behavior. That's called lapse. Relapse is a series of lapses, a loss of control, and a return to previous behavior. Immediate determinants like high risk situations, a person's lack of coping skills, they can cause relapse, which means the client can return to previous behavior. Here are some examples of high risk situations. For example, eating out, holidays, traveling and vacationing, snacking, stress, fatigue, hunger, urges, food cravings, lack of social support, lack of coping skills, negative self-talk. These are all examples for high risk situations. Another major category is covered antecedent. These are the factors that precede a relapse, but these are not obvious. These are not obvious factors. These are not like high risk situations. So we have four covered antecedents, which are apparently irrelevant decisions, stress level, cognitions, urges, and cravings. Urges are sudden impulses to indulge, but cravings are subjective desires to experience the effects of an indulgence. We need to incorporate relapse prevention strategies into our counseling session. And these are designed as a follow up treatment to maintain gains made during an intervention. So, we need to introduce the topic of relapse prevention to our client. We need to describe the relapse prevention model. We need to identify high risk situations and inform our clients that there are high risk situations out there that can cause relapse. And this is an example how to do that. I mean, here is a script to do that. So there are some strategies to handle high-risk situations like lapse management, cognitive restructuring, urge management techniques like contract to consume a certain amount of the food, causing urges and cravings. Have a plan for a response when the urge arises. Plan for a non-food countering activity, use an image technique, and so on and so forth. Ending the counseling relationship. There are different reasons for termination, for ending a counseling session for good, like insurance coverage, or let's say the counselor and the client or both will feel that counseling goals have been made, or if there is any referral to a specialist or a psychotherapist. So we need to have a reasons for termination, and we need to provide transition time. The final meeting dates should be agreed upon, and we need to discuss reasons for ending and share perception of clients' progress and request clients to voice their views. So we need to, in our final session, we need to review beginnings. We need to discuss progress. We need to emphasize successes. We need to summarize current status. We need to explore the future and discuss future involvement. We need to provide feedback. For example, it has been, as a counselor, we can say, it has been such a pleasure working with you. I want you to know that I will miss our weekly meetings. I want you to know that I really appreciate what you have taught me about Cuban culture. Consider holding a ceremony and exchanging symbols and final goodbye. Unfortunately, all closures are not tidy. Sometimes clients simply do not show up for a session or they cancel future appointments. If this is the case, we can send a termination letter or text or email, wish to reinforce achievements and leave the door open to a future association. And this is an example for that. For the counseling evaluation, this is important for our growth as a counselor. We need to take time to assess the quality of our own skills. And there are different parameters used for evaluation. Like, this is kind of a self-evaluation. Like, we have behavioral, physical, biochemical, functional. We can use this evaluation for our client progress as well. So for client progress, um, these evaluation can be behavioral, physical, biochemical, and functional. But for counseling evaluation, we need to evaluate ourselves. Which of the following is essential for an effective evaluation of client progress in nutrition counseling? The first one, setting well-defined measurable goals and tracking them over time. This is goal attainment scale. The value is from -2, -1, 0, 11, and 12. And they have their own description and behavior. So at the end of an intervention, a final assessment should be conducted to determine the degree of attainment of final goals. If a follow-up interaction was arranged at the termination, a post-treatment evaluation can be conducted. Care measure tool is very important. It was developed to measure a doctor's relational, empathy during consultations with patients. So we can use these forms to kind of evaluate the counseling effectiveness and skills. We can have the clients to complete these forms and send them back to us or electronically return these forms. So we can give these forms to clients at the end of the session, at the end of the intervention. So care measure is one of them. We can also assess clients' non-verbal behavior. Because, non-verbal behavior of a client represents a key to their emotional state. Any discrepancies between a client's nonverbal behavior and verbal messages should be noted. We have like checking, which allows counselors to evaluate whether they are on target during a counseling session. And we have charting. Charting can be a valuable tool to evaluate counseling effectiveness as well as client progress. We have also counseling checklist, which can be done at the end of a session. And these are the questions to consider if general counseling goals were not met. Video, audio tape, or observation evaluations can also be used. So, as a counselor, last time you set a goal to walk for 30 minutes 3 times a week, and you have met that goal consistently. That's great progress. Let me make a note of this in your file so we can build on it next time. So this evaluation is charting. So charting is a valuable tool to evaluate counseling effectiveness as well as client progress. The assumption can be made that if counseling goals have been met, then the counselor demonstrated effective skills.